Psychologist at the British CBT Counselling Service. And in this video, I'm going to explain what CBT is. So CBT is a talking therapy, and it's currently the most effective talking therapy that is available. And it helps for all sorts of things: anxiety, depression, eating disorders, obsessive compulsive disorders, relationship problems, sleep problems. It can help with chronic pain, and it can help everybody: adults, children, couples, families. So let's look at what it involves. CBT stands for cognitive behavioural therapy. So let's look at the first part, the cognitive part. Cognitive basically means our thoughts. So I'm going to draw a diagram to help explain a little bit more about this. So the idea is that our thoughts influence how we feel. So if we are struggling with how we're feeling, so we're feeling anxious, we're feeling depressed, the way to change how we feel is to look at our thoughts. So in CBT, we would identify the thoughts that are making us feel anxious or depressed, and then look at how accurate and how helpful they are, and then look at trying to develop alternatives that will bring down our levels of anxiety and depression. The second part of cognitive behavioural therapy, the behavioural part, let's look at that. So the way that we feel then influences what we do, our behaviour. So when we feel happy, we go out in the world and we achieve things. When we feel sad, we withdraw. Our behaviour also influences both how we feel and how we think. So the second part of CBT involves looking at our behaviour, looking at those behaviours that are basically making things worse, making us feel more anxious, making us feel more depressed, and then feeding back into how we feel, how we think about things, which is then feeding back down to how we feel about things. So in the therapy, you will identify those behaviours that are unhelpful and look at replacing them with behaviours that promote calmness, happiness, satisfaction, fulfillment, a sense of achievement in your life. So that was a whistle-stop tour of what CBT is. In the next few videos, I'm going to look more specifically at CBT for particular disorders like anxiety, depression, eating disorders, bereavement. If you have more questions that I haven't yet answered, please post them in the comments. On this channel, I look at everything to do with mental health and how you can best cope with that. So if that's something you think would be helpful for you, please subscribe, and I will see you soon.